Why Kegels might not be working. Your pelvic floor in perimenopause. So you've been told to strengthen your pelvic floor and you've done the Kegels, maybe you followed an app, maybe you clench while brushing your teeth or stopped at the traffic lights like somebody told you to. But you're still leaking sometimes or feeling pressure or sex doesn't feel quite right. So here's the question no one's asking. Is your pelvic floor actually weak? Is it because you're getting older, going through perimenopause or menopause, or is it just not working the way it should and could? Because there's a big difference, and if you're only treating weakness, you might be missing the real issue. Why Kegels aren't working? Well, Kegels are often prescribed as the go-to solution for pelvic floor issues, especially after babies and also later in perimenopause. But the reality is that for many women, more squeezing or harder squeezing doesn't help. In fact, over-squeezing can make things worse. If your pelvic floor is already holding tension or isn't coordinated with your core and your breath, Kegels won't resolve the problem by themselves. They might even create more pressure, more dysfunction, and more frustration. So before you keep doing more squeezes, let's look at what your body might need instead. What does lack of coordination actually mean? Well, when we say a muscle is weak, we tend to think of something soft or inactive. But pelvic floor dysfunction isn't always about a lack of strength or tightness. In many cases, it's about a pelvic floor that's holding too much tension, a hypertonic pelvic floor. This means the muscles are overactive, tight, or unable to relax, which can disrupt function just as much as underactivity does. True pelvic floor health is about timing and coordination and responsiveness for relaxation and release as well as strength. Your pelvic floor is part of your deep core system. It works in sync with your diaphragm, transverse abdominis, and multifidus to manage pressure and support movement. When you inhale, your pelvic floor should lengthen. When you exhale and move, it should lift and support. But surgery, trauma, stress, poor posture, or years of compensation patterns and movement can break that connection and your brain stops cueing those muscles correctly. So when you try to contract your pelvic floor, you feel kind of nothing, or you're gripping without control, or maybe you're leaking despite all your efforts. It's not weakness, it's just that it's not responding properly, and it's extremely common, especially in perimenopause. According to the International Urogynecological Association and pelvic floor health physiotherapists, pelvic floor dysfunction is often about coordination, not just raw power. Dr. Jen Gunter writes that many women have persistent symptoms and are never assessed for tension or overactivity, but they're told to just keep doing Kegels. But a tight, unresponsive or poorly sequenced pelvic floor can't do its job. And in fact, trying to strengthen it without restoring coordination is like trying to run on a sprained ankle. You don't need to force it, you need to retrain it. Common signs your pelvic floor might not be responding properly are leaking during unexpected moments like walking or lifting, a difficulty to start up or to then fully empty your bladder, a feeling of heaviness or dragging despite regular Kegels. There may be pain during sex or during internal exams, flat or ineffective breathing patterns. This is where so many women get stuck. You're working hard, but your pelvic floor isn't responding. This is where function first rehab, like MUTU system, changes the game. You rebuild the connection through breath work, full diaphragmatic breaths that let your pelvic floor release and respond and contract. Alignment, stacked posture that reduces pressure and allows proper cueing. Gentle movement, exercises that link your breath, core, and pelvic floor as one team. We're not guessing here. This is clinically proven, evidence-backed, and used by pelvic health professionals around the world. When your pelvic floor is cued by your breath and supported by your alignment, then it starts to respond reflexively, and that's when control returns. Imagine you're about to sneeze. In a responsive system, your pelvic floor lifts automatically just before the pressure hits. Or say you're picking up a heavy bag and you exhale and your core engages, your pelvic floor supports you, all without clenching. This is the goal, function that you don't have to think about. So stop clenching all day just in case, because this is exhausting your muscles. Stop doing Kegels without checking for overactivity. And stop thinking that you need to get stronger. And think instead about getting reconnected. Your body isn't broken, it just needs some better instructions. Now, if no one's ever explained it like this, Now you know. It's not about doing more, it's about doing it differently. MUTU teaches exactly this with safe, supportive, evidence-based tools to help your pelvic floor respond, not just resist. The link is below. When you're ready, there's a 10-day free trial, so just check it out risk-free. Now, if sex has started to feel uncomfortable or different since you've entered your 40s and perimenopause, watch the next video. There's a reason and your core has everything to do with it.